Why is mesothelioma lung cancer so aggressive? Imagine a cancer that grows silently for decades before suddenly revealing itself with symptoms that come on fast and fierce. That's what makes mesothelioma one of the most aggressive lung-related cancers. And like other lung cancers, mesothelioma starts in the lining around the lungs called the mesothelium. This lining is a thin, protective layer that normally helps the lungs move smoothly inside the chest. When asbestos fibers are inhaled, they can lodge deep into this lining and stay there for many years. Over time, these fibers cause ongoing irritation and damage to the mesothelial cells, leading to mutations in their DNA. This process triggers the cells to become cancerous, often in a slow, sneaky way that hides its presence for decades. The biological factors that make mesothelioma so aggressive are complex. Asbestos fibers physically interact with the cells, causing direct damage, but they also set off inflammation that further harms the tissue. This chronic irritation activates genes that promote uncontrolled cell growth and disables the body's natural tumor suppressor mechanisms. The cancer cells can rapidly multiply because asbestos exposure activates enzymes like telomerase, which helps cancer cells avoid aging and death. This combination of genetic changes fuels quick tumor growth and makes the disease resistant to many treatments. Anatomically, mesothelioma's spread is different from other lung cancers. It tends to invade nearby tissues directly rather than spreading through the bloodstream or lymphatic system. The cancer often begins on the parietal pleura, the outer lining of the chest wall, then spreads to the visceral pleura, which covers the lungs. From there, it can invade the chest wall, diaphragm, and even the mediastinum, the central part of the chest. Because the pleural cavity is a continuous space, cancer cells can easily shed into the fluid that surrounds the lungs, making local spread rapid and difficult to control. This local invasion often occurs before symptoms appear, which delays diagnosis and treatment. Treatment resistance is another key reason for mesothelioma's aggressive nature. The tumor is often resistant to standard therapies like chemotherapy and radiation. This resistance is partly due to the complex biology of the cancer cells and their ability to repair damage caused by treatments. Additionally, delivering effective doses of therapy to all affected areas is challenging because the tumor covers large, irregular surfaces within the chest cavity. As a result, even aggressive treatment often only extends life rather than cures the disease. One of the most troubling aspects of mesothelioma is its long latency period. It can take from 20 to 50 years after asbestos exposure for symptoms to develop. During this silent period, the cancer grows quietly, often unnoticed until it reaches an advanced stage. When symptoms like chest pain, shortness of breath, or persistent cough finally appear, the disease is usually quite advanced. By then, the cancer has often invaded nearby organs or spread to distant sites, making treatment even more difficult. Once symptoms emerge, mesothelioma can progress rapidly. Fluid buildup around the lungs, called pleural effusion, can cause severe breathing problems. As the disease advances, patients may develop blood clots, bleeding issues, or blood clots in the lungs, leading to life-threatening complications. The median survival after diagnosis is around a year to a year and a half, highlighting how aggressive and challenging this disease is. Even with treatment, the outlook remains guarded, especially for the more aggressive subtypes like biphasic mesothelioma, which contains both epithelioid and sarcomatid cells. From a lung health perspective, mesothelioma underscores the importance of preventing asbestos exposure. It also highlights why early detection is so crucial. People with occupational exposure, such as construction workers, military veterans, or industrial workers, need regular health monitoring. The disease's rapid progression after symptoms appear makes early diagnosis vital, but it's often missed because early signs are nonspecific. Understanding why mesothelioma is so aggressive helps reinforce the need for protective measures and medical surveillance, especially for those at higher risk. In summary, mesothelioma's aggressiveness comes from its biological makeup, its ability to invade local tissues quickly, its resistance to treatments, and its long silent growth period. All these factors combine to make it one of the most formidable challenges in lung health. If you have concerns about asbestos exposure or symptoms, always consult healthcare professionals for personalized advice and early testing. Protecting lung health starts with awareness and prevention.